Hi, my name is Brianna Rudolph, and I am a RN to BSN nursing student at Troy University. Today, I will be performing a head-to-toe assessment on my patient. Do you give me permission to record this assessment?
Yes.
Okay. My patient is a 35-year-old female. We have already collected her health history. We've already obtained her vital signs, and they were all within normal limits. Now she will change it to a gown. I will also give her a urinal cup and explain to her how to collect a clean catch specimen, and she will bring it back into the exam room. Okay. Okay, now my patient has changed into a gown. However, she does not feel comfortable with removing her pants or her undershirt. Okay, so now I will inspect her head. I will feel for any lumps, check her scalp. Her scalp is healthy, shiny, hair is evenly distributed. No lumps. Have you had any headaches or anything?
No.
No? Okay. Can you lift your eyebrows for me? Okay. Do you feel any tenderness?
No.
Any tenderness?
No.
Okay. I have palpated her frontal and maxillary lymph nodes. Can you open your mouth for me? Okay. That is no pain, which is cranial nerve 5, which is in normal limits. Okay. Now I will just do a general assessment of her skin. No lesions. Skin tone is even. Pigmentation is even. Appropriate for race. No redness. Eyebrows are symmetric and bilateral on both sides. She does have eyelashes. Now I will go and check her eyes. Like I said, she does have eyelashes. Her eyes are not red. Her sclera is white. Her conjunctiva is clear and normal. Now I will look inside of her eyes. If I had a scaling eye chart, she would do the eye acuity test. However, I do not have that. But if I did have one, I would have my patient stand 20 feet back and read the clearest line and judge by that of what her sight is. Okay, look straight at me. Okay. All right, her pupils are round and equal. They do react to light. Next, we will do, let's see, I'm going to check her cranial positions. Follow my pen, please. All right, her cranial positions are within normal limits. Now I will do the accommodation test. Can you follow my finger, please? Okay, and she is within normal limits. Now we will do the confunction test. Can you cover this eye for me? All right, and follow my finger. Okay. Cover the other eye. Follow my finger. Okay. Good job. That's also within normal limits. Now we will go to her nose. If I did have a ophthalmoscope, then I would have checked her red reflexes. Now we will go to her hearing. Her hearing. All right, correction, I do have my ophthalmoscope, so I will check her red reflexes. Okay, and that's within normal limits. Now we'll move on to her ears. I'm just going to make a general inspection of her ears. There's no lesions, no redness. They're bilaterally. Are you experiencing any pain at all with your ears?
No.
Okay. I will look inside of her ears. All right. Her ear canals are clear, minimum wax. Everything was within normal limits. Now I will be doing the whispering test on her.
Christmas. Birthday.
Okay. My patient has passed the whispering test. Now I will move on to her nose. Just general view of her nose. It's symmetric, not red, midline, no skin issues, color is even, there's no drainage. Do you mind covering your right there? Breathe in, breathe out, left, breathe in, breathe out. Okay. They're patent. So now I will go to her mouth. Lips are red, mucous membranes are more than pink. Do you mind opening your mouth for me? All right. Teeth are white. Doesn't look like she's missing any teeth. Can you look your tongue, hold your tongue out for me? Okay. All right. I would do a gag reflex on her. However, I'm sure she wouldn't like that. But I would use a tongue blade for that. And if her tonsils are present, if they're present, it'll be a 1+. Okay. So after that, I will go ahead and ask her to move her shoulders up and down. Okay. Any resistance? No. All right. So I'm going to go ahead and palpate her cervical lymph nodes. All right. They're not palpatable, or do you have any tenderness at all?
No.
All right. Now I will have my patient to stand. All right. Now her trachea is midline. Any tenderness at all?
No.
Okay. While I just have her standing, I will go ahead and check her carotid arteries. All right. They're present 2+. Now I'm gonna just assess her back, and it is clear. Skin is clear. No skin issues. Okay, can you breathe? Turn this side to the camera for me. All right. Can you breathe in for me? Out. Okay. Check suspension was normal. I'm gonna palpate her spine. Any tenderness in that at all?
No, ma'am.
Okay. Now I'm gonna do the tactile Themis 4. All right. All of that is within normal limits. Now, after I have inspected, we will now do the percussion of it. All right, turn to the front and I will do the same thing. All right, so actually let's do that. Turn back around for me. I'm sorry. All right, can you say 99?
99.
Okay.
99.
99.
99.
Okay, can you turn to the front for me?
99. 99. 99. 99.
All right. So now I will have turn this way for me. I will inspect the front. General skin is good. Now I will do my percussion. Alright. Tactile femurs. You do it again. 99.
99. 99. 99.
Okay. You can have a seat for me. Now I will listen to my patient. Deep breath. Out. In. Out. All right. Listen to the subclavicle. In. Out. In. Out. Okay. All right. Her lung fields are clear. Now I'm going to explain. Because of privacy, I can't do a breast examination on her, but I will explain to her the process of doing a self-examination, breast examination. Ma'am, you look first. Place your arm above your head. Look into a mirror at first. Make sure there's no drainage coming from your breast or your nipple area. Then you will lay flat, remaining with your arm behind your back. You will start at your nipple line and you will palpate in a circular motion to check for any lumps. If you feel any lumps, you report it to the doctor. The best time to do your breast examination at home is 5 to 7 days post-cycle, okay? Okay? So now that I have reviewed that with my patient, I will now just check under her axillary for any lymph nodes. Okay, no tenderness, correct?
No.
And they're not palpable, okay? Now we will go to the chest area. General inspection, symmetrical, skin looks great, all of it within normal limits. All right, I have palpated, no thrills. Now I will listen to her. First, I will listen to her aortic. Okay. Pulmonic. Her herb and tricuspid. Pause it.
Tricuspid. And make sure.
I'm going to auscultate her heart sounds. Aortic, harmonic, herbs, and tricuspid. Her mitral and her apical. That is not the right word. Stop it. Right, now I'm going to listen to her lung sound. Her heart sounds. All right, they're all clear and within normal limits, normal rate and rhythm. You will listen to the apical pulse for an entire minute. Next, we're going to go to her abdomen area, and I'm just going to simply inspect it. Look for any skin discoloration, any lesions or anything. All of that is normal. Now I would listen to her. Do you mind laying back for me? I will listen to all four quadrants. And you will listen for 4 minutes in each. Excuse me. And after you re-listen, you will I'm gonna just percussion on it, okay? You tuning in?
No tenderness.
Alright. Okay, after you do that, you will palpate. I'm sorry, you will do your percussions first. Alright, after you do your percussion, you will also do your percussion of your liver and your spleen. So your liver is first, and then you would do your spleen. Okay? Any tenderness?
No.
Okay. So now I will palpate. Then you would do your deep palpation. Let me know if you have any tenderness. Alright, 4 quadrants, spleen, and liver is all within normal limits. No tenderness noted. Okay. After that, you would check her reflex level on it, and I'm gonna do it with just a dull object. Okay. All right, and that's within normal limits. Okay, after that, we're gonna go to the extremities. We're gonna palpate her for more artery. If she was, for privacy, we won't do it, but you will palpate in this area. It should be present, and it should be at least 2+. Okay. After that, I would just inspect her lower extremities. Alright. No lesions, skin, no discoloration. All of it is even. No tenderness noted. I've inspected and palpated. Now I will palpate for her different poles. Alright, her popliteal poles are present 2+ bilaterally. Posterior tibia, I will palpate that as well. Alright, that's 2+ as well and present. Dorsalis pedis, I will have to take your shoes off for that. Sorry. Alright, they're present and 2+. Can you hold your legs straight out? Can you move them in a circular motion? Okay. Full range of motion in both. Can you move your ankles? Alright. Good job. Next we will check her different reflexes, okay? If you have the right equipment, you will have a reflex hammer. I currently do not have a reflex hammer. However, I will demonstrate where the areas are supposed to be. Okay? The first place is her biceps. So you will feel it like right above the elbow. And it should be positive on both sides. Then you would do her triceps. Same concept of hitting in the right area, and you should have the same reflex as well. Then you would do the brachioradial area, and you should be able to hit in the right area, and it should have a reflex as well. Then you would do the popliteal, which is in this area here that you should be able to hit there, and it should have a reflex as well. And then after, it's going to be after her ankles here, in this area here, and you should have a reflex as well, okay? I've observed her gait as she was walking in the exam room. It was steady, balanced, no issues with that. Now we will do her neuro, all right? So I want you to touch your nose and then touch my finger, okay? Okay? So she's good on that. Can you stand for me? Can you move your heels up to your shin? Okay, the other one. All right, that's good. So now I want you to do what we call the wombo. You're gonna stand like this with your eyes closed. Okay, the appropriate time has gone by and her balance is good, so it's within normal limits, okay? Now she would do what we call the heel toe. What you would do is you would have your heel in your toe, okay? Can you demonstrate that for me? Okay, so that's all within normal limits. You can have a seat. Do you have any questions about your exam at all?
No, ma'am.
Okay. I personally thank you for giving me the opportunity to perform the head to toe assessment on you. Thank you.